I recognize the member from Don Valley East.
Thank you, Madam Speaker. I move second reading of Bill 67, an act respecting the licensing and regulation of temporary nursing agencies.
Mr. Samji has moved to a second reading of Bill 67, an act respecting the licensing and regulation of temporary nursing agencies. Pursuant to Standing Order 100, the member has 12 minutes for your presentation.
Thank you, Madam Speaker. It's always an honor to rise in this great chamber to discuss the issues of greatest importance to Ontarians, particularly healthcare. It's especially nice to be able to have that discussion, recognizing that we have healthcare workers on all sides of the chamber who have done incredible work to serve patients and our friends and family here in Ontario. Today I rise to speak to my private member's bill, which seeks to regulate temporary nursing agencies in our province. And I hope to do this by going through a number of things. Over the course of this evening, I hope to begin by describing the landscape of healthcare in Ontario, the rise of temporary nursing agencies within that context, their impact. And by setting the stage in this manner, I'll explain what my bill does, its benefits. I'll distinguish it from other efforts to regulate temporary nursing agencies, and then address some anticipated concerns. In our province, we have a healthcare system under tremendous strain. A healthcare system that has been brought to its knees by COVID-19, brought to its knees because of healthcare worker burnout and mental health struggles, unimaginable workloads, and wages that have fallen behind the rate of inflation in Ontario. And amidst that backdrop, we have seen earnest efforts to try and improve this situation. And yet, despite this, for the reasons I mentioned, we have a massive shortage of healthcare workers, resulting in ER wait times that have gone through the roof. The time to transferring patients from the ER into hospitals has gone up. The number of patients designated ALC has gone up because there aren't enough staff beds in long-term care. And we even have emergency departments that have closed, especially in rural areas. And as a result, we've seen the rise of temporary nursing agencies. These outcomes, while devastating, have resulted in hospitals and long-term care homes wanting to do anything to stay afloat. These temporary nursing agencies have provided a pool of nurses available who can fill in for absent workers on short notice. Now, they've existed for a long time, make no mistake about it, but their usage has risen dramatically in the last few years. Unfortunately, the impact of these nursing agencies has been profound. They've exacerbated our health human resource crisis by attracting nurses out of the public system by the allure of higher wages. They've caused hospital budgets to balloon. In Ontario, nursing agencies, hospitals spent nearly $39 million on nursing agencies, and that number has now ballooned to $174 million just last year. It's led to a demoralization of our healthcare workforce, and it's led to lower quality care. In short, we have a situation where there is the wild, wild west. Some of the stories that I've heard: nurses being recruited out of hospital parking lots. We've heard about agency operators who also own long-term care homes and double dip in profits. We've heard of nurses who are recruited out of their hospital jobs by the allure of wages 2 to 3 times higher than they were paid in the public system, only then brought back to work in the very same hospital, on the very same ward that they worked in the day before, but at 2 or 3 times the cost. And of course, we hear all the time about ballooning healthcare budgets because hospitals are spending too much on temporary nursing agencies. My bill seeks to remedy this challenge, and it seeks to do this by being fair, balanced, pragmatic, and not onerous. As it stands right now, anyone can operate a nursing agency. There are no requirements, there are no fundamental regulations that exist. There's no mechanism to guarantee, for example, that they operate fairly, safely, or sustainably. And I believe that there is a duty to regulate them. Bill 67, my private member's bill, offers a minimally invasive approach. It calls for simple things, like a requirement to license a temporary nursing agency. And that license can be issued by a ministry-appointed registrar who meets some very basic criteria. They have to know what they're doing. They have to have an understanding of healthcare. And so a basic understanding of healthcare regulation and quality improvement. And in that capacity, they make sure that licensing applications are complete and that terms and conditions are met. And of course, if those terms and conditions are not met, they don't issue the license. If those terms and conditions cease to be met, they have the power to revoke that license. So far, I would argue, all very reasonable. The terms and conditions are quite basic. They would require nursing agencies to have a credentialing and monitoring plan, essentially to make sure that the nurses that are going into these hospitals or long-term care homes or home care agencies have a certain basic education and are appropriate for the locations that they're getting sent to. For example, it would never make sense for an emergency doctor to be asked to perform an appendectomy or general surgery. In the same way, a nursing agency would have an obligation to ensure that a nurse who has experience in long-term care homes works in long-term care homes and not in intensive care units. Now, the terms and conditions intend to take aim at some of the most predatory practices that are taking place in nursing agencies. So, for example, they can't have carte blanche to financially starve our public health care system. And they're designed to uplift the morale and working conditions of nurses. So, here are some very basic principles. A nursing agency must establish consistent and predictable fees. What we've seen in the current climate is some nursing agencies take advantage of dire situations. Some even engage in dynamic pricing, exactly the way you might see your Uber price go up in the middle of rush hour. But this is healthcare. That kind of pricing model does not belong in our hospitals and long-term care homes. The bill also introduces the concept of unconscionable pricing. In essence, it says that nursing agencies can't engage in price gouging. Now, this is something that I know the government cares deeply about. We see the principle of unconscionable pricing articulated in Bill 142, for example, and this government also introduced legislation against unconscionable pricing of PPE earlier during the pandemic. So I know that this is a fair principle. These nursing agencies can't hire nurses out of a hospital, can't send nurses back to a hospital that they've worked in the last 6 months. They can't poach, and they can't have restrictive non-compete clauses. And finally, they have to publish expenses, revenues, and profits yearly. The bill is enforced through a simple mechanism. There can be inspectors, and there is a licensing renewal requirement every 2 years, providing an opportunity to ensure that all of the terms and conditions continue to get met. In short, what this bill accomplishes is it stops putting nurses at odds with each other, because you can imagine how demoralizing it is to work alongside that's making 2 or 3 times what you're making, and it was just because they come from a nursing agency, especially if they were just working as part of your hospital the day before. It'll uplift morale, reduce reliance on agency staffing, reduce the amount of funds that are spent by long-term care homes and nursing agencies, and it levels the funds spent by long-term care homes and hospitals, and it simply levels the playing field. Now, I want to take a moment to distinguish this from other efforts to regulate nursing agencies. In August 2022, the Minister of Health introduced a plan to stay open with great fanfare at Sunnybrook Hospital. And at that time, she said, "We recognize that agency rates have increased significantly, creating instability for hospitals, long-term care homes, and emergency departments." The plan at that time had been for consultations to happen with frontline partners. And as yet, they haven't happened. In March 2023, the member for Markham-Stouffville, who is then the Minister of Long-Term Care, proposed initiating a technical advisory committee to look at temporary nursing agencies. And I thank the Minister for his foresight on that, and yet it still hasn't happened. And then finally, just yesterday, my friends on this side of the House introduced Bill 144, another attempt to regulate temporary nursing agencies. And I distinguish my bill from theirs in that my bill is focused on the nursing agencies themselves, whereas their bill is focused on the hospitals and long-term care home providers that have no choice but to use those nursing agencies. Now, I want to anticipate some of the concerns. Now, yesterday was Halloween, and I want to reassure people that there's nothing scary about this bill, despite the fact that yesterday was October 31st. Some have said that the nursing agency usage rates have fallen to 2%, and therefore any form of regulation is not necessary. Unfortunately, that's not quite true. Nursing agency rates are higher than 2%, and even where they are lower, the lowest, in hospitals, they are significantly higher and increasing in long-term care homes and in home care agencies. There's also the argument that more nurses are on the way, and I agree and congratulate the government side for increasing the amount of nurses going into nursing schools. However, there has not been an effort to actually retain nurses. And so what we see is pouring water into a bucket that is unfortunately full of holes. And for as long as that situation remains, we will not be able to maintain an adequate number of nurses. There's also been the argument that regulation is against free market principles. And to that, I would say we have a market failure because we have a dramatic shortage of healthcare workers. And even Adam Smith would tell us there's a role for regulation in the presence of market failures. Others have said that there are problems with non-compete clauses and that it's unfair to say that an agency cannot send a nurse back to the same hospital that he or she worked at the day before. But currently there is not a level playing field. And in fact, nursing agencies currently can impose non-compete clauses that say if one of their agency nurses works in a hospital or a long-term care home, they are not subsequently allowed to go back and work there permanently. And so non-compete clauses are not applied fairly currently in the healthcare landscape. And then finally, some people worry about transparency, about the fact that this bill asks nursing agencies to publish their revenue and profits. But this is no different from publicly traded companies that regularly do that. And remember that these nursing agencies are using public funds. And so there's nothing to be afraid of, and there are many precedents within our province. And so in conclusion, we're all here because we care for each other and for Ontarians. We want the best healthcare system, and we want to look after patients and healthcare workers. Bill 67 is simply a prescription to do that. It's fair, it's logical, and it's comprehensive. It has been formulated through extensive consultation with stakeholders, policymakers, and healthcare workers. And it simply levels the playing field and ensures that taxpayers get fair value for money and equitable access for healthcare. I thank you all for your consideration.